As someone who has Medicare, either Original Medicare or a Medicare Advantage health plan, you have a right to high-quality health care. This short video will talk about free Acentra Health services that can help. This is good information to have and can help with issues you may have with your medical care now or in the future. Acentra Health is the beneficiary in Family-Centered Care Quality Improvement Organization, also known as a BFCC-QIO, for the 29 states that are highlighted on this map. Acentra Health has three main services that help people who are on Medicare: the appealing or stopping of a hospital discharge or the stopping of skilled services such as physical therapy, the filing of a complaint about the quality of your health care, and immediate advocacy services when healthcare issues need to be taken care of right away. This video will give you an overview of each of these three services. These services are free to people who have Medicare and their families and representatives. There are two types of appeals: hospital discharge appeals and skilled service termination appeals. If you are a patient in the hospital and you are being sent home, but you feel you aren't ready to leave yet, you can call Acentra Health and ask to appeal or stop the discharge. This is called a hospital discharge appeal. In order to appeal your discharge, you must be considered an inpatient. There is no official way to appeal your discharge if you are in observation or outpatient status. Be sure to ask your doctor what status you are in. If you have Medicare, you have the right to appeal if you do not agree with the decision that your skilled services will be stopped. This is called a skilled service termination appeal. Skilled services refers to services ordered by a doctor and provided by health professionals like nurses and physical therapists. Skilled services include things like wound care, intravenous or IV therapy, or receiving physical therapy. If you are not happy with the quality of medical care you had from a healthcare provider, such as a hospital, skilled nursing facility, or a doctor's office, you may want to call Acentra Health to file a quality of care complaint. These are some examples of when you may want to call Acentra Health to make a complaint about the quality of care you received: not getting the right care for your illness, or not getting a full discharge plan before you leave the hospital. If you want to file a quality of care complaint, Acentra Health can help you write out the complaint. Immediate advocacy services can be used when people need to quickly fix an issue with their medical care or services. Here are some examples of when immediate advocacy may help. When you're having communication issues with healthcare providers. An example is when patients and their families can't get all of their questions answered by the staff, such as the doctor or nurse. When you are waiting to get medical equipment delivered to your home. Sometimes there can be a problem that you can't solve even after talking with the medical equipment company. During times of crisis, such as a bad weather event like a hurricane. During these times, Acentra Health gets calls from Medicare patients with issues such as prescription refill concerns and discharge questions. Do you need details about the Acentra Health services you heard about in this video? You can view detailed videos here on YouTube. Please see the links in the YouTube video description below. For more information about Acentra Health services for people who have Medicare, visit our website at www.acentraQIO.com/services.